Welcome back to Access Health GY. I'm speaking with Dr. Marvin Wilson, who has disclosed some of the risk factors and signs of a miscarriage. He also talked about the importance of seeking help in order to avoid postpartum depression, an illness which often goes undetected.
If you have an ailment that is not under control, so women that are hypertensive, women that are diabetic, women that have some other ailments, heart condition, asthma, also women that have very large fibroids, women that are very young, women that are advanced in age. In maternity, advanced in age means over 35. So once you have one of these risk factors, you have an increased chance of having something like a miscarriage or an abortion. The issue with it is that not because you have one of these ailments means that for sure you are going to have a miscarriage. However, if you do have one of these risk factors, then it is better for you to ensure that everything is in order as much as you can before and during your pregnancy.
Okay, so what are the early signs to detect that you might be having a miscarriage?
A lot of persons in the first 3 months of their pregnancy, more so in the first month of the pregnancy, may refer something very similar to their period, but it might be a bit lighter, something of this sort. However, that is fairly common. That is known as implantation bleeding. Usually after the first month, maybe into the middle of the second month, it tends to clear up. So if you are more than 6 weeks pregnant and you're still getting spotting or you're still getting bleeds, then you should check that up. That may be signs that you may be having or already had a miscarriage.
Okay.
Other things that may point in the directions are things like abdominal cramps. You may find that you get constipated, abnormally constipated, or you may find that you have recurrent diarrhea, or you just may feel, generally you may just feel bad, you just feel sick, you don't know why. But on the flip side of that, a lot of these symptoms are fairly general. So as long as you're attempting to get pregnant, even though you're not certain if you've gotten pregnant, once you're getting something that is, a bit out of the sorts, it's worth checking it out.
Okay. Is there a way to prevent a miscarriage that has started, per se?
There is no actual way to prevent a miscarriage that has already started. That now is because of the terminology. There's a miscarriage and there's an abortion. A miscarriage happens within the first 4 months.
Okay.
An abortion happens after the first 4 months. In the first 4 months, the size of the fetus, it's too small for us to actually be able to do something to actually stop it from coming out if it begins to come out. After that, usually depending on how far along you are in the course of the abortion, something may be done to prevent it from going the full course.
Because you've heard cases where women say they started spotting, then they go to the hospital, and when they get there, they didn't get the required attention, and eventually they had a full-blown miscarriage. So that's why I'm asking whether there's something that doctors can do in that initial stage to prevent this from actually completing.
Well, once again, it depends on the age of the pregnancy.
Okay.
But usually once it's early pregnancy, once you haven't begun to show, or you just began to show, once it's diagnosed that you are having a miscarriage, there's nothing that can be done to stop it.
All right, let's talk about a postpartum period. How important is this in pregnancy? In motherhood, rather?
Postpartum is very, very, very important, not only for the mother, but also for the child as well. That is where the body now begins to once again change, and you have another stage happening there. Now you have the breast producing milk, you have the womb that would usually shrink and go back to its normal size. However, it takes some time for your regular cycle to get back into how it is. And for some time, usually in that for about the first month to 3 months, once you're breastfeeding, you have relative contraception, meaning that it would be very, very difficult for you to get pregnant again in that first 3 months. Some women, it's the entire 3 months. Some women, it's 2 months. Some women, it's 1 month. So anywhere between 1 to 3 months.
But I've heard the saying you can easily get pregnant just after delivering.
You can. It's not specifically easy.
Okay.
However, because no two individuals are exactly alike,
True.
Some women, it tends to be a lot easier than some women. So because of that, generally we say, once you're not doing anything to prevent yourself from getting pregnant and you are of childbearing age and you have been pregnant before, then basically you can get pregnant again.
Okay, but generally, do you have any other issue that you think women need to be enlightened about as it relates to this entire process?
A lot of women actually do experience what we call postpartum depression.
Okay.
Many persons do not recognize it, and a lot of those that do, they just ignore it. It is an actual illness, it is an actual ailment. In many cases, women learn to cope and it can resolve on its own. However, it can leave long-lasting mental scars, not only for the mother as well as the child, the relationships surrounding that family as well.
So what are some of the support systems that they can access when going through this? Let's say they would have recognized that you're having this problem.
Well, once you recognize that you're having strange feelings about yourself or your child or your life after having given birth, you can visit any one of your local health centers. You can speak to one of the nurses there. Most of the time it's a midwife that will attend to you. And they can point you in the direction of where you need to go, if it is to speak to the doctor, if it is to see the social worker, if it is to see the psychologist, psychiatrist. There are a lot of different specialities that come into play when you're dealing with these types of mental ailments.
You spoke about it having an effect on the child as well. Elaborate a bit on this.
Yeah, these effects can range from, you can have actual physical effects, because if the mother is having negative sentiments towards the child, then she might shun the child when it comes to things like feeding, cleanliness. If the child picks up some ailment, a cough or cold, she might not be as willing or, might not be as quick to do something about what is going on with this child. Additionally to that, as the child grows, just after having this child part, when you're breastfeeding and everybody's happy and jolly and you're playing with this child and you're so happy to have this child, in that part, what studies have shown, what research has shown, is that if a child doesn't have that, then they can grow up with certain sentiments or certain mental issues or psychological issues that don't actually manifest until later on in life. So you can have your child having simple issues like attention deficit disorder. You can have them having personality disorders, all because from the get-go they weren't given that nurturing sensation. They weren't given that loving feeling, that even though it's not something that you can see and touch, it is something that is necessary for the upbringing of a child.